So as it now stands, leptospirosis is an epidemic in the Philippines. But at what level should it get before it can be declared as a, what do you call it, like a public health emergency?
Yes.
Or what the proper term is for this?
So, Attorney Karen, to begin, I wouldn't say that it is an epidemic of national proportions, and I'll explain why. The term epidemic or outbreak, that's another synonym of epidemic, means that the number of cases has exceeded a comparable a number in a comparable situation, typically the previous year, for a specific locality. So, I would say that at this point, it is alarming because the numbers are high. But there are formal requisites before we can declare an epidemic, and it's important to declare an epidemic on a localized basis. Let me explain. Republic Act 11332, or the short name is the Notifiable Diseases Law, it's the governing law that tells us who gets to declare if there is a state of public health emergency, who gets to declare if there is an epidemic. There's a separate law, the RA number escapes me now, but I think this is the National or the Disaster Risk Management Act.
That RA 10121.
There you go. Yeah. Thank you, Attorney. And that is what empowers LGUs to declare a state of calamity. So you have three terms: public health emergency, epidemic, and state of calamity. Let's go through them one by one. Beginning with the state of calamity. A state of calamity is not necessarily due to a health concern. There could be other reasons, war, well, that's extreme, maybe infrastructure problems or a typhoon, yes, state of calamity. And to our simple understanding as non-lawyers in the department, this is a mechanism that allows local governments to access funds faster, quick reaction of funds. So, a state of calamity, as heavy as it sounds for the news cycle, doesn't necessarily mean there's a problem in terms of health. Now, what about outbreaks and epidemics? The reason why the same law I mentioned, RA 11332, Section 7 in particular, empowers local government units to make the declaration themselves is because risk communication is very important when it comes to disaster or public health emergency response. Let me explain further. Imagine if the DOH, yours truly as spokesperson, started announcing that LGU-A, LGU-B has an outbreak, and then the provincial government is not aware or maybe has a delay of knowing and has not prepared. It would result in a communications breakdown because people would be, of course, irritated at each other, which will also impair coordination when it comes to the response. Whereas, as the law says, if it is the local chief executive who declares, then everything would be ready. Once they declare that there is an outbreak, then this is the response. We are able to move this amount of resources, this amount of people, ready our hospitals, and so on. The last point I wanted to mention, so who gets to declare a state of public health emergency nationwide? That's where the Secretary of Health comes in, but it's not the Secretary of Health who does so, it's the President of the Philippines. The last time we did this was in COVID-19, when former President Duterte, on recommendation of the Secretary of Health, who was part of the interagency task force, based on scientific data, said, yes, we have a problem nationwide. So that's the only time that the DOH will say that there is a national epidemic. So every time I am asked now, Attorney Karen, our response is by law, it is actually the local government chief executive who should be declaring outbreaks. As I think Quezon City is saying that they have hotspots for dengue, there are a few other localities that have taken it upon themselves, invoking this authority to declare outbreaks of dengue in their particular areas.